Hi, everyone, and welcome to another edition of Public Health Chats, where today we are discussing public health training, specifically the Masters in Public Health in South Africa. I'm very pleased to have with me today representatives of 6 universities across South Africa who have generously given their time tonight to walk all of us through the various training platforms, the admission requirements, the actual course requirements for Masters in Public Health at their institutions, and some general advice on how to navigate the process. So having said that, we are going to jump quickly into our first speaker, who is from Sefako Makgatho University. So Prof. Matilda Makgatho is a professor and acting head of Department of Public Health at SMU. She holds a doctoral degree in educational psychology and a master's of public health with expertise in the areas of biostatistics, social and behavioral health sciences, and health systems management. She possesses over 33 years of professional experience in the care services, of which 24 years are positioned in the domain of academia. In addition to her duties of Professor of Public Health, which includes teaching the following courses, which are research methods, health programs evaluation, population health management, and biostats, she is an established and diversified researcher who occupies positions such as research consultant, research associate, and the supervision of master's and doctoral students. She is particularly has extensive research in sexual and reproductive health and rights and innovative interventions for prevention and control of HIV, AIDS, STIs across population groups. Professor Makgatho, over to you.
Thank you, Atia. Good evening, colleagues. Let me just shoot straight into the presentation. Where's the, okay, I don't get that, okay, yeah, I am. Then, yes, the Department of Public Health has got 4 units in epidemiology, biostatistics, health systems management and policy, environmental and occupational health sciences, and social and behavioral health sciences, which are basically the streams that one could choose a specialization when they take on public health. We have a staff complement of 18 full-time academics within these 4 units of divisions. But we have a new entity which is head of doctoral programs, that is, aligning doctoral all the doctoral programs in the department. So from this staff establishment, 75% are PhD holders. We host an NRF chair. We have 5 full professors and 2 research associates. We are 100% online, in our offerings for teaching and learning. So students can, take on all the courses while they are where they are based at their workplace. More so that we are attracting only employed, professionals to ensure that we contribute towards people being orientated to public health within offerings of the public and private healthcare services. Our platform is Blackboard, Ithuta Blackboard, and we train all our students on that, and hence we need all students to be computer literate and have possessions of proper tools, appropriate tools for them to be able to to go into virtual classes, interact virtually, and even do their research project virtually, except for their field work if they need to go out and meet participants in the field. So we have our online application systems. When you get into SMU website, you will see our administrators for the university, and we also have dedicated public health staff members as administrators that would help you into navigating into our system if you encounter problems. Our entry requirement is a 4-year bachelor's degree in a health-related and social science field, or you have to have a 3-year bachelor's degree with a 3 with that a 3-year, then you have to do a postgraduate diploma or have an honors. Then you can be accepted into the public health program. Then we have many applicants. Then we've developed a system of screening and attracting the most appropriate candidates into our system. With we have a ranking system of appropriate qualification, being employed for more than 2 years, and understanding what you need, what your needs are within public health. And then you will also be tested to be able to use virtual platforms. We engage you and take you in as you log yourself into our classrooms during that exercise. Then for foreign students, they will need SAQA, South African Qualification Authority. What is this? The SAQA qualification verification and the language proficiency as we attract countries from the region, mainly the African continent. Then we, from the 4 divisions that I showed you in the first slide, we will have core public health courses, health systems, health promotion, environmental, occupational health, epidemiology, biostatistics. Then you can, from our electives, the cognate or track specific, you can also, select what you want to use and focus on for your career in public health. So we have a compulsory 100% online virtual summer school and winter school programs, which is 2 weeks or 5-day weeks, and we spread the notional hours within the semester so that the first week will introduce you, but over time, when we support you through the program, we will spread the notional hours for this compulsory virtual school into the daily, monthly teaching sessions. Then these are the courses that you take as fundamental public health courses in the first year of your MPH course, your health promotion, health systems, research method, as a module that will prepare you for your to go into the field, to be ethically cleared. Then environmental or occupational health you choose. Then we have biology, epidemiology and biostatistics. Then your proposal by the end of the first year is completed. Then you continue with activities of ensuring that you get ethical clearance and go to the field. And in your second year, for the generic public health that we are running, because of shortage of staff, we trimmed it to this, this few cognate courses within health systems, epidemiology, biostatistics, social and behavioral health sciences. Then by then you will have met the requirements of having 8 modules for getting your MPH and second semester of completing your research project, and that has been doable since we were reviewed and advised accordingly. We are achieving this one. Then we have electives because we have a full staff establishment. These are our electives when people want to take track specific modules to channel their career in either health systems, biostatistics, epidemiology, occupational and environmental health. They will definitely package themselves along the modules that you see here. And then we have lots of applications, but some, I'm glad that we are here because appropriateness is usually a problem. So I think these webinars will definitely help us attract the relevant people. Then you'll find that out of 500 applications, 200 are relevant. As 80 of them would meet the criteria for now. Now, because of our staff establishment, and we have automated our modules now so that we can focus on research projects and other, academic activities, we will, be, increasing our intake to 120 because of, the automation of our modules. And we our selected candidates usually perform well, with the new reviewed public health program, thanks to the colleagues, some of the colleagues that are in this, from UP, from this platform, help us to really fine tune and run this program, and we can produce more. Today we were graduating 61 Master of Public Health students, 30 postgraduate diploma. We would want to, have a bigger intake there, and 5 PhD candidates. And we are looking for more because we will be having a second graduation where we can even double our output for this year. So we are ready for the public health intake of 2025. Thank you very much, colleagues and Atia, if there are any questions.
Thank you so much, Matilda. I think that was great. And we will probably, there's a range of questions that I'm sure will come through. So we will get to them as soon as we get to the Q&A section. So I'm gonna now move on to our next speaker, who is Dr. Jill Olivier, who is an associate professor at the University of Cape Town School of Public Health and Family Medicine in the Health Policy and Systems Division. She convenes the Masters in Public Health program at UCT, chairs the Coursework Masters Committee of Assessors, teaches on health systems research, and supervises masters and PhD students. She's the PI of several multi-country studies and has research experience in Africa, Asia Pacific, and the Americas, and is currently chair of the Health System Global Thematic Working Group on Social Science Approaches to Health Policy and Systems Research. And she's a member of multiple global networks. Jill, over to you.
Thanks, Atia, and what a great idea this is. Good evening, everybody. Sorry, I'm sitting at home, so that's why the camera is so bad. And I don't have any slides. I did chat to Atia about this earlier, so we decided to not do slides. So I was very impressed by the previous presenter's slides. Let me speak to you about the Masters in Public Health at UCT. All of this information that I'm going to say is sitting on our website, so I will also put the link to the website in the chat just now. So just to start off with, the Masters in Public Health at UCT is a very well-known degree. We have a huge gap between applicants and intake. We get many hundreds of applicants every year. We probably take in around 120 each year. And so across the different cohorts, we usually have around 250 to 300 master MPH students on the MPH program at any given time. In the brochure, it's stated that it is possible to do the degree in 1 year. More often, people tend to take 2 years to do the MPH. And those that are working full-time, which is really most of our students are full-time professionals while they're doing the MPH, they tend to take around 3 to 4 years to do the MPH. We are a face-to-face program, although we got very hybrid since COVID, but we are still a face-to-face program that does require sort of residence in Cape Town during at least the first year or the coursework component. It is possible to do the dissertation at distance, and some of our courses have some hybrid options, but generally it is still a classic face-to-face program. We have been discussing and debating this for many years because there's a lot of money in online MPHs, but we still believe that there's real value in the face-to-face engagement. We feel that the engagement between teaching staff and students, the possibilities of discussion, and as well as the relationships and networks that students build between each other really can only be done face to face. So we are currently sticking to that approach. We have a slightly different configuration to the previous presenter. So we have what we call 6 tracks of MPH. We have 6 flavors or specializations of an MPH. There are actually 7, but I don't want to confuse you. So let's just say if you're going to apply to the MPH, you would see 6 options. The one option is Epi and Biostats, which is by far our largest specialization. We have a social behavioral sciences track, an environmental health track, a health economics track, which is one of the leading health economics programs in Africa and the world. We have a health systems track, which I run, and what was previously a community eye health track, but has just been recently, from next year, is going to be run as a global surgery track, which if you know, global surgery is a massively growing terrain of work within public health, not just within surgery. So we're very excited by that. We've got some world-leading people developing out a new track. So what that really means is that I'll give you a breakdown of what a track looks like, but everybody does a set of core courses. So there's a set of, so pretty much everybody does a course like Introduction to Epidemiology, everybody does a course called Public Health and Society, and from there on, the tracks have different sets of required courses that build their specializations within their areas. So then just going back to the intake story, so when I say we usually have an intake of about 100 to 120 students a year, that is spread out across the different tracks. So just to give you an idea, in the health systems track, we usually only take, we have a highly limited intake of it because it's a very specialized area, and it requires a lot of attention from core teaching staff. So we really only take about 10 to 12 students into the health systems track each year. So that's to give you a sense that there's a slightly different configuration of the different tracks. We are usually, in terms of intake, we have about 60% South African students and 40% international. We have a high prioritization of lower middle income country internationals. So this is truly a global degree, but with a strong Afrocentric focus. We have a rolling application system. So in this year, the applications will close on the 31st of May, the 31st of July, and the 31st of August. We're doing it like that because students tend to require, students that are applying for bursaries or visas, we're finding have to apply earlier and earlier. This year, for example, we had a number of students who applied for visas 4 months prior and didn't get a visa in time. So really what that means is if anybody's interested in applying, the earlier you apply, the better if you're having to apply for things like visas and bursaries, because you would really need to know early on, you need to start applying early on. What a rolling application system does mean, however, is that you accept students in each series of applicants, and so what that means is you do get to a point where some cohorts are full. So your chances are much better in the earlier applicants than they are in the later applicants, but we do carry on considering and reviewing the applications. The application process, we have a very similar minimum requirements. I think all the MPHs do in the country. For us, it's a 4-year bachelor's degree. So either a 4-year degree or a 3-year bachelor's plus an honors or equivalent. Evidence of adequate quantitative skills, evidence of adequate written and verbal skills and communication skills, including proficiency in English, and a demonstrated interest and or experience in public health research and practice. And what that demonstrated experience, that usually comes out in the application. That demonstrated experience usually comes out in the CV, but it also comes out in the covering letter that is required. So we tend to get a lot of applicants who talk about how they're keen to work in public health because they had an unwell family member sometime in the past, and that kind of application is really interesting, but it's not as effective as somebody who has clearly thought about the field of public health and has some knowledge of it. But just to say, these are the minimum entry requirements, so that will get your application to our review committee. It does not guarantee admission. So for example, we might have each year, we might have between 500 and 800 applicants who meet those criteria, only accepting a small proportion of them. We have an online application system. You submit a CV, a covering letter, and your academic transcripts. We very often have people who kind of just try, they will submit part and not the transcripts, or this and not that. And unfortunately, given the huge demand for our program, those kinds of applicants tend to fall out quite rapidly. So there isn't really much room for submitting things that are incomplete. We were asked to speak to what our institution looks for in candidates. I mean, given the limited places that we have, it's very competitive. And so as such, we would be looking beyond those minimum requirements. We'd be looking for a demonstration of strong academic skills, strong skills in reasoning and critical thinking. And in particular, we look for experience in public health research or practice. That's not to say that if you have an undergrad in social sciences, for example, that we wouldn't consider your application. But we really are usually looking for people that have some experience through work or through volunteering, or some kind of exposure to the world of public health. Just to give you a sense, our current students are not young, inexperienced people with no knowledge of the world. They tend to we have people who are the ministers of health in different African countries. We have people who are leading UN agencies and institutions. We have people leading in NGOs. We obviously have doctors and varieties of clinical staff and managers. We have people from the South African Department of Health at all levels, provincial, national, presidential. So just to give you a sense, I'm not trying to intimidate anybody, but just to give you a sense that when you are thinking about applying, some level of experience and knowledge of the world is as useful as your academic transcripts from your undergrad. The other thing we do look for is diversity. So we are very focused on diversity, both in terms of geography and disciplinary backgrounds. So in terms of geography, we really do look for applicants from across the world, including, as I said, across South Africa and across LMIC settings. And we look for diversity in terms of your background. So we have students from all disciplines. We have from all the varieties of the health sciences. We have students from all the varieties of the social sciences, humanities. My one current student is a philosopher. She's doing really well. Economics, the sciences. We've got currently got students from the built environment, education, law. Our law students tend to do very well, engineering, and we've got a couple of journalists as well. So the disciplinary background is not as important. Atia, do I have a few more minutes? Sorry, I just saw you put your video back on, so I thought maybe I ran out of time.
You are out of time, so if you can maybe just...
Sure, that's fine.
Yeah.
So just in conclusion, so just to say, in terms of what the training entails, we do have these different tracks. Each track has different configurations. Some require 10 courses and a dissertation, and some require 8 courses and a dissertation. We have over 30 MPH courses to choose from, but it obviously depends on what track you are on. And just to say that we really are focused on ensuring that you come out of the UCT MPH with key core competencies, both the general competencies that any MPH should expect, such as EPI and biostats at analytics and social cultural awareness and analysis. But we also do have very specialized competencies that we develop across the different tracks, including systems thinking, economics evaluation and analysis, etc. So I think it's just to say that whatever track you might be interested in, whatever specialization you might be interested, the idea is that you would still receive those core public health competencies across the MPH. Thanks, Atia. Sorry, I wasn't watching the time at all.
No problem. Thanks, Jill. I think, your point around the value in face-to-face learning is something we can pick up on, because I think given the demand for public health or masters in public health training, people, there's value in each of these different methods of training, and I think it's something that I would like us to unpack later. So I'm going to hold that question for just now and move on now to the University of Free State, where Dr. Findile Shangasi is the academic leader and senior lecturer in the Division of Public Health, Faculty of Health Sciences, UFS. She holds a PhD in public health with a special interest in smoking cessation, as well as social determinants of health, including implementation science. She teaches in health professions education programs since May 2021 and has over 11 years higher education, teaching, supervision, and research experience. She also holds a Bachelor of Education degree, as well as other trainings in digital health, learning, and learning analytics. Her current research study is based on the use of learning analytics within the Faculty of Health Sciences to enhance student success. Pindile, over to you.
Oh, thank you, Atiya. Let me just start by saying that our program is still fairly new. The first intake of students was last year, and they started on the second half of last year. So we are currently developing taught modules or a taught program. At the moment, we only have Masters by Research and obviously PhD program. And with regard to the intake, last year we did get quite a number of applications, and this year we're also getting more. The intake at the moment is once a year, and the closing date is end of August. Since we don't have taught modules, it's only MPH, Master of Public Health by Research, and we do run support workshops online, as well as other support endeavors via Blackboard. And some students do come in to see us at some point when needed. And we have a diverse range of discipline within our program, as well as supervisors from different backgrounds. Some are based within our health sciences, others are in different parts of the world. And we also work closely with the Center for Graduate Support that helps us to run workshops every month for students on research, on writing up, on so many other aspects of masters by research. And some other facilitators actually go to different regions in South Africa, as well as Lesotho, Botswana. It depends where the Center for Graduate Support is able to locate a facilitator. And the admission requirements to register for the master's degree of public health, a relevant Bachelor of Honors degree in a health sciences discipline or social sciences qualification, or a relevant four-year bachelor's qualification that should be at NQF level 8 in a health sciences discipline, or an appropriate postgraduate diploma at NQF level 8. And let me just say that as other universities, we also have a selection committee of the Faculty of Health Sciences. So when we get applications, we go through them for the selection to check first who meets the admission criteria. As other colleagues have just said, we also require SAQA verification for all qualifications obtained outside South Africa. And someone who's an applicant should have worked as a health professional or is currently working as a health professional, or a public health practitioner, or a social scientist, social worker, or health sciences educator, and someone who is doing research within a public health field. We have so many research institutes out there, or someone working in the public health as a public health administrator. And we also require at least 1 year work experience in a field that is related to public health or health sciences environment. And the recommendations also can be done under prior learning and experience. And so we look at the credits that were gained and the experience gained. That is a separate process altogether. Whoever wants to be admitted via RPL, that is recognition of prior learning, needs to submit an application for that, but we take them through the application process. The duration of MPH can extend over 2 years full-time, Although when you go to our website, you will note it written over 1 year, but in reality, our students do take, 2 years. Although we took students from last year, we have noted that some, are yet to collect data. Some are already collecting data in the field. Some can luckily finish end of the year, although they started second half of last year. So it depends on the speed and commitment as well. And our MPH entails 180 credits. And I would say that we also encourage diverse, specializations, because we have supervisors with diverse specializations. We have epidemiologists as hands as well, biostatisticians, others who have majored in psychology and work as psychologists. And we also have forums where students can join in, to present something within the research proposals, and we can all make an input. And we do hold so many sessions with students. Some depend on the need. And as I was saying, we're a fairly new program and we're still developing. We do have a couple of international students within our intake. In MPH recently, or last year, which we had an intake, this year we had an intake of about 26 students, and we also have a cohort from last year. So the current applicants for next year will depend on how many meet the admission criteria. And when someone is applying, the process is online application with all your documents uploaded. We also have a template for your research proposal, although it's more of a research concept, but we need to see that you understand what you want to do within your research studies. And you understand exactly what research is, what research methods are, although we do fill you up once you are admitted as a student. So that is a very important criteria, because we actually look at your short proposal or your concept notes and take it from there to check if it aligns to public health. And we also, in our application form that is completed and uploaded online, we encourage students or applicants, to identify a potential supervisor, because others would have a senior member of staff that they work with within their field that they'd like to be the supervisor. However, we also have to add a supervisor from our Faculty of Health Sciences. If a supervisor was not identified, we work with the concepts of student, the concepts note, that is a short proposal, to check who we can allocate. And if we allocate from our outside partners throughout the region and abroad, we also pair up that co-supervisor with someone from the faculty, or if the other one is from outside the university, is the main supervisor, we get a co-supervisor from the faculty. So the concept note or the short proposal that the student submits is very important, because that is what we use as a selection criteria. The documents are important as well, because if they are short, we are unable to process, your admission. We need all documents in place. So the sooner one applies, the better, so that if anything is short, then we can go ahead and inform you. Thank you very much. I hope I've provided all needed information. Thank you.
Thank you, Pindile. Yes, I think so. I did not know that you could do a master's purely by research, so that's interesting to know. And I think the point that both you and Joel made around making sure that your documents are complete is a really important one for anyone wishing to apply. So thank you for that. I'm going to move on now to UKZN with Dr. Siyabonga Dlamini. Siyabonga holds a PhD in public health and has worked on a number of projects as a researcher at UKZN. Oh, sorry. He is highly experienced in the area of behavior change, including the development of HIV, AIDS, and STI interventions, focusing on prevention and gender-based violence prevention. He has also been involved in the program evaluation studies in the province. He has led research field teams and coordinated research studies, and is now, amongst other things, coordinating both the MPH and the postgraduate diploma programs in the discipline, and is a module convener of one of the postgraduate diploma modules. He has graduated a number of students in the Masters of Public Health program. Siyabonga, over to you.
You're muted, Siyabonga.
Thank you. Good evening, everyone. I'm sorry. Okay. Thank you, Ache, for inviting me to be part of this a wonderful gathering. Yeah. So let me just get started. By the way, these are my contact details if you maybe want to grab a screenshot or something like that. And this is a way of outline for my presentation. Okay, and this is where we are located. So at UKZN, we've got at least 4 colleges, and we're located at the College of Health Sciences under the School of Nursing and Public Health. And yeah, so we are the discipline of public health medicine, and I'm going to talk about the MPH. So basically, our eligibility criteria are not different from what other colleagues have mentioned. And so I won't really spend much time on that. And so the application process is also online, and there's an advert that is sent out in July of each year, and it's open until September of that year, because we're aiming to finish with our selections by the end of the year, so that when the year begins, you know, students are able to get themselves sorted and get ready to start the curriculum. And so this is an example of an advert that will be posted online in our website with all the details. And so there will be additional instructions in terms of what is needed for submission, like what other colleagues have mentioned in terms of, you know, motivation letter, your academic transcripts, your CV, you know, all of those details. They would need to be included as well. And just to mention that we do also have international students that apply and that partake in the course. So on a regular, we have over 250 applications, both locally and internationally. And so for those international students, you know, they will have to submit an you know, SAQA equivalents in terms of their qualifications from other institutions, and then once accepted, they would have to also apply for a student visa. And so typically in the first year, we would have between 25 and 30 students. So you can imagine that the process is highly competitive. From over 200 applications, it boils down to between 25 and 30 students. And the reason for that is we're not a big discipline. We have about 12 academic staff and about 4 administrative staff. So it's not a large discipline. So yeah. And so in terms of the curriculum, we the curriculum, well, the whole program has 192 credits, and 50% of those credits are modules, and then the other 50% is a research project. And I must stress that our research project is not at a descriptive level, but the students have to do an analytic kind of a project. So from its design, it has to be analytic in nature. With the electives that we offer, it doesn't mean that every year all those electives will be offered, because it depends on the number of students that have actually opted for those electives. And so if the minimum number is less than 10, that there's a chance that that elective will not be offered that year. Currently, we don't have specializations or streams or tracks, as other colleagues have mentioned, but I'll go to it in terms of what is on the pipeline and what we're currently working on with regards to that. And so this is the program outline. So the modules that I'm showing right now, these are the core modules. So the modules that the students have to have gone through and passed in order for them to be able to attain an MPH at UKZN. And these are the electives that the students then can choose from. And as I said, depending on the number of students that elect to or opt for that module, it will either be offered or not offered. In terms of assessments, so we've got formative assessments which can range between 3 and 4 assessments, and they are usually weighted. And then you have an exam where the students have an opportunity to write a main exam and a supplementary. And so with the university policy, a student doesn't have necessarily to write a main exam. They can opt to write a supplementary, but the disadvantage of that is that they have one opportunity to write an exam. And if they fail that exam and they didn't do well in their assignments, then unfortunately they would not pass that module. And then in terms of the dissertation, we encourage our students to go there. So we still have the traditional route where we've got those chapters that their dissertation would follow. But what we encourage our students to do is to follow the route where they publish a paper. But that doesn't necessarily mean that the students would have published that paper, or the paper would be accepted at the time of examination. They could have it as a manuscript that they could later on send for publication, or that manuscript could have already been sent to for publications for as they submit for examination. And so this is the kind of format that we follow for that. And so I also spoke about the developments that we are currently engaged in. A couple of years ago, we had our MPH review, which as an outcome of that, it's been suggested that we then have specialized streams that the students can choose from. So we're in the middle of that process. We had hoped that by next year would start offering these streams. Unfortunately, due to unforeseen circumstances, we're now aiming to start with these new streams in 2026. And so we'd have an EPI stream, biostats and EPI stream, health systems and management stream, and social behavioral stream as well. Thank you. That's the end of my presentation.
Thank you, Siyabonga. I think it's very, I'm just finding it very interesting, the different programs, and I think we really need to have a discussion at the end about how to pick a program that is suitable for the purposes of what people are aiming to do. But thank you for that overview. I'm going to move on now to University of Pretoria. Dr. Sean Patrick is a senior lecturer in the Health Measurement Sciences Division at the School of Health Systems and Public Health at UP. He holds the position of Secretary of the Public Health Association of South Africa, Vice Chairperson of the Associations of Schools of Public Health in Africa, and the Global Network for Academic Public Health. He is a subgroup member at the Global Network for Academic Public Health and a member of the Management Committee of the UP ISMC and Center for Environmental Justice, Faculty of Law. Dr. Patrick's research on endocrine disruptors has led him to explore transdisciplinary approaches to health, merging the fields of public health, engineering, and the built environment. Patrick, over to you.
Thank you. Thank you for the kind introduction. I will share a little bit about the MPH program at the University of Pretoria. I think it's quite interesting when I hear what the colleagues are saying. We have had similar things with the MPH students that are often taking quite long to complete. So our MPH program was restructured, and the restructured program started in 2022. So what I will share with you is how that program really has changed. There we go. So to give you an idea, we take about 100 to 120 candidates every year, and those are the numbers since 2020. And we graduate about 50 to 60 students per year. Our applications open at the end of March and they close July 31st. Our admission requirement, because the MPH was recurriculated, one of the entry requirements is a postgraduate diploma in public health, and I'll tell you on the next slide why. Or if the applicant doesn't have a postgraduate diploma in public health, if they at least have a degree with equivalent learning in some of the courses that have been done, provided there is also a for the other criteria as well. So when the MPH was restructured, we realized that majority of the students take more than 3 or 4 years to complete. So what we did is we moved our postgraduate diploma degree to be fully online, and that is now one of the entry requirements for the MPH program. So the postgraduate diploma is fully online, and since 2020, we have about, I think we've graduated about 300 students per year, and at any given time, there's about 900 to 1,000 students in the program. So currently in this year, the modules would run for 7 weeks at a time. We'd have 6 intakes per year, and this would generate the pool of applicants that would apply for the MPH. So this has 2 benefits for us as UP. One, if you're looking at the structure, it touches on the basic principles that are required, the core competencies for public health. But it also allows a student in the last module start thinking about a type of research project that they want to do. So I also teach in that last research protocol module, and what I do is I try and align the student's topic with the research focus areas of the staff, full-time staff, as well as extraordinary appointments that we have within the school. So when the student would apply for the MPH the following year, they at least come in with a draft protocol that has been talked through. That makes it easier to pair the student with a supervisor in the first 3 months of the year in order to attain this graduation period of 12 months. And we've actually had end of last year, we had a student register. Actually, no, had a student register January 2023, and she actually completed at the end of 2023. We actually 2. It was the first 2 students out of the PGDIP program went into the master's program with this research protocol already there. So we find that really has worked. So the application process, just a few timelines. It is done fully online. Application process opens in March, ends in July. Our screening is also done online between August and September, and the application is scored and different weightings, such as academic merit, The motivation letter, we're taking into account, as some of the other universities, also about underrepresented groups, public health rate employment. We then aim to notify the student by October, and there's only one starting point, which is January in the following year, and the MPH is also face-to-face. So if we take a walk through the MPH, like I said, it's a minimum of 1 year, maximum of 2 years. It has 2 components, the core modules, as well as the dissertation. So once a student in the first 3 months, because the majority of the students, we make allowance for external students as well, but majority of our students have done the postgraduate diploma at UP. Within the first 3 months, we're able to allocate a supervisor because we've tried to streamline the topics they would then choose, and then the student would then either choose one of the tracks that I've mentioned on the side, and the student would then plan the modules as well as their research. The student will have to pass the coursework independently, at least 50%, and the research work at least 50% as well. Now, because we've moved the core modules as epidemiology and biostats to the PG DIP, we have an applied module called data science for public health, where we revisit epidemiology and biostats, as well as some of the other topics, but now we're looking at advanced analytics, data science, machine learning, for example, as an introductory course, in order to have the students apply what they've learned within their postgraduate diploma. So the MPH core modules as such, we have a module global governance and diplomacy, which is quite relevant in the area to currently find ourselves in. We have module scientific writing, and so similar to UKZN, we also encourage our students to submit a publication. So it's not required for the degree, but in order to help the student to write the paper, we have a specific module that is dedicated to that. The student can then choose the different tracks. What we've done is we've tried to group to try and group the modules together. So in disease control, we recommend this is option number 1, and with a few additional modules you can choose. There's another option 2, so it's quite a wide variety. Environmental occupational health, environmental health is also a number of modules we ask the students to choose, and so environmental occupational health policy and management, for example, and as far as health promotion is concerned. So we talk about the types of students that we get. So because we have moved the bulk of the core competencies, if you like, to the postgraduate diploma, the entry requirements of the postgraduate diploma, the students we get into that program are extremely diverse, from diverse backgrounds, the nurses, the doctors, we have lawyers, social workers, there's from geography, economics. So the diversity is created within the postgraduate diploma, and everyone in that program is taught the basic principles of public health. When they then apply for the master's, we're now looking at applying that knowledge you've learned. So we find that doing it this way, there's greater variety within the master's, the cohort, but everyone walks in with at least a basic understanding. And the MPH essentially becomes application of the knowledge. And your research project is then tailored towards the research for the research that the academics within the school do. We do have a number of extraordinary supervisors that we also have. And we find that by doing it this way, our students actually do complete in much period of time is decreased from 3 to 4 years down to, at least now we're down to about two to 3 years at least. And our first 2 candidates through this new curriculum that's actually completed within a 12-month period. I think I've covered everything. Yep, I think I've covered everything. Thank you. Thank you very much.
Thank you, Sean. That was great. So last but not least, I'm going to move on to Wits University, where I'm going to say I'm an alumnus, and move on to Dr. Nicola Christophides, who is an associate professor of the School of Public Health. She heads up the division on health and society within the school and has more than 20 years research in gender-based violence, HIV, and evaluating social and behavior change programs. Her research has focused on how services for survivors of sexual violence are delivered, as well as the role that gender-based violence plays in reproductive and sexual health outcomes. She is currently a co-investigator on a study that is investigating the intergenerational transmission of violence. Nicola, over to you.
Thank you. Thanks, Atia. And it's really great to be part of this event and fascinating to actually hear all the MPH programs back to back like this, or at least a selection of them, it's not all of them. So I'm going to talk about the MPH program at University of the Witwatersrand, but I want to just start by saying that I'm going to just talk about the MPH program, and we also have a Master of Science in Epidemiology and Biostatistics at WITS. So I'm not going to talk about that through the presentation, but if anybody is interested in epidemiology and biostatistics, I really would suggest that you go and have a look at the MSc program at WITS, and there are 6 tracks in the MSc Epi and Biostats program, which include field epidemiology, infectious disease epidemiology, implementation science, public health informatics, biostatistics, and field epidemiology. So if anyone is interested in any of those topics, please go and have a look at the MSc program. So now I'll talk about the MPH program here at WITS. Now it's not moving on. Just give me one sec. Okay, so I'm going to talk about the future because we've just undergone a restructuring of our MPH, and from 2026, the program will be 240 credits reduced down from 360. With 120 credits of coursework and 120 credits of research. At the moment, the MPH is only offered part-time to accommodate working professionals. The coursework is delivered over 2 years, and the research is completed in the 3rd year. And our admission requirements are very similar to those that have already been mentioned by the other programs. So in terms of the mode of delivery, we have contact teaching time. So at the moment, we offer our course through what we call block release, which means that students come for 5 days, consecutive days, and complete the face-to-face contact teaching component of the course, and then do some self-study. So there's e-learning platforms that extend learning among students and allow for some deepening of the content. And this allows professionals to continue working while studying. So in terms of teaching methodology, in the face-to-face contact sessions, very much problem-based, student-led and grounded in students' experiences. And we have a couple of integrated assessments that integrate concepts across the core courses rather than only having individual courses assessed, so that it allows graduates to be able to integrate concepts across to address public health problems. So these are the fields of specialization that we currently offer on the MPH. So students can undertake an MPH in health systems and policy, in maternal and child health, in social and behavior change communication, exposure and health, rural health, and health economics. So those are our current fields of study. These are the core modules, so just a little bit of the logic of the foundational or core courses. So students start with a course called Health and Society, which talks about equity and what underlies good and poor health. And then they then move on to thinking about how to measure health outcomes and risks and determinants through the introduction to epidemiology and biostatistics, which we call Health Measurement 1. And then they go on to to do a course which is now going to be combined, that deals with the approaches that impact population health that impact health and well-being at a population level. And then they move on from that to a course on designing effective public health programs, which considers planning, prioritization, and monitoring and evaluation, amongst other things. And then there's a course in health and health services management, which then addresses the issues of human resources, budgeting, quality assurance, and leadership, amongst others. And then all students will take 4 field-specific courses. So if they're doing health economics, for example, they would start with the introduction to health economics and then go on to do the economics of healthcare financing, and then economic evaluation and decision modeling. So there are 4 sort of specific courses that would allow for the deepening of the field-specific knowledge. So in terms of career paths, I thought it might be useful. While we do require some experience for students to be accepted into our programs, and most students are employed full-time, we do find that sometimes students actually are wanting to have a career change, or to really sort of like develop a new career path. So in terms of that, there are various employers. So government is obviously a big employer, both at national and provincial departments of health, but also other government departments employ potentially our graduates. We have many of our graduates who go on to work for, or are already working for, NGOs, for non-governmental organizations, both international NGOs as well as national NGOs. We have a number of graduates at the moment who are working in UNICEF, UNFPA, and so on. And then also some of our graduates are working in research institutions like the Medical Research Council or CDC, and so on. And then we have some students who work in private sector, for example, pharmaceutical companies, mining industry, especially those who are doing fields of exposure and health, and also health economics. So in terms of applications, just to say that the applications are reviewed by a field of study committee, which means that nobody can apply for a general MPH. You have to make a decision about what field of study you're interested in at the point of application. We then apply selection criteria that are not dissimilar from those that have been described before. We review academic transcripts, the strength of the motivation, writing strength, and experience in some work experience within the field of study, and all related. And if an applicant has a very strong motivation and wants to change their career path, we do sometimes recognize that the student has some ability, and we do sometimes accept students on those criteria. And then, of course, the referee reports. Our next intake is in January 2026. So applications will open in March 2025 and will close on the 31st of July 2025. So that's it from the WITS experience. I'm very happy to answer any questions related to this, and you can find more information on our website. So thanks very much.
Thanks, Nicola. I'm going to invite everyone, all of our speakers, to put their cameras on so we can go into the Q&A portion. But I have to just say, while they're doing that, your opening picture was of my MPH class.
Yes, I selected it on purpose.
We all looked, well, me specifically, look considerably younger without the gray hair. But thank you, everyone. I really appreciate this. I mean, I've learned so much about MPH programs across the country. I do want to say, before we open to just speak to some of the specific questions, is that it's clear from these presentations that there's that the field of public health is quite broad, and Nicola's touched on a little bit about the MSc EPI. Jill also highlighted that there are other institutions that are doing MPHs and MSc. I would encourage you to go and do a little bit of reading around that. Unfortunately, we can't capture everything in one webinar, but I will say that I have been doing, and I will send this around, I have been doing a few career chats with colleagues across public health. And if you want to hear firsthand about field epi or implementation science, if you look at my LinkedIn, which I have sent around and I will send around, there are videos that will help you understand from colleagues who have actually studied that, because I think the field is very, very broad, and hopefully this doesn't confuse you even more. What has also come out, I think, from these discussions is that there's a few decisions that anyone who is aiming to do an MPH will have to make. And I think some of the broad criteria is whether you want to do a general MPH or if you have an interest specifically in a particular stream. There's, as you can see, there's modular MPHs or modular and research or research alone. And again, you'll have to think through some of that. Obviously, online versus distance, online versus in-person learning. And I think we can discuss a little bit about those pros and cons. And then also, I think there's a wide range of reasons people do MPHs. Some people want to go into the public health field formally. Some people are looking to augment their skills or to just learn a new set of skills and knowledge. And so that may also guide your decision making. And then obviously, whether you have a potential to do it full-time or part-time. So I think these are just some of the criteria you may want to consider as you are deciding on a program to select. But I'm going to start off quickly with, I think, a question, and I won't do an entire round robin just for purposes of time. But if any of the colleagues would just like to reflect a little bit more on these sort of selecting whether you want to do an online learning. There's obviously you could do a postgraduate diploma as well, which some institutions have. But I think there is value in online learning versus in-person versus a mixed approach. So I don't know if anyone wants to reflect on what they see, the different or perceived value of selecting one over the other as candidates make their choice. Yes, Joel? Is that a manual?
I don't know if I'm supposed to do online hands or real hands. Sorry, Siad probably did the right thing and put his online hand up, so maybe I should let him go first. But okay, I'll just say, I mean, in our experience, we're very similar to Wits in that we do face-to-face, but we try and structure it for working professionals. So we try to do block teaching and all of that kind of thing. I think it's not quite as straightforward as online or face-to-face. I think everybody's trying some version of hybrid approach to try and make allowances for professionals. So we have people that fly down from Joburg for the face-to-face components, for example, for those weeks. However, I think I think it was Charmaine or somebody was putting a question in the chat. If you're somebody who knows that you just can't get away for blocks of time, I think you need to look for like a fully online MPH, because they're designed to be fully online and their learning environments are structured for that online learning. So they do have the fully online MPHs have a lot of support and all of those kinds of things, chats and all these things. I mean, we all do, but they have those kinds of things. However, I'm a little bit of old school in that I do believe that the face-to-face component does really add something. And so if you can afford, both in finances and in time, to do an MPH with a face-to-face component, I think it really does add value to the MPH experience, to the networks you build, to the people you meet. There's just some things you can't do online. So it's really a case of what can you do, what can you afford, and find the one that suits you. And I'll be quiet. I'm sure Sia has a better answer.
Thanks, Joel. Sia?
Yeah, thanks. I have to agree with Jill on this, because we had when we went online because of COVID, one thing that we noticed is that the engagement and interactions between the students and also the facilitators of the different topics, you sort of lose the essence of that. and that experience. And when it's like in person and people are sitting in one room and they are interacting, pulling from their experiences, the teaching and learning experience is so much more enriched because of that process. Obviously, one can talk about the advantages and disadvantages of the different modalities in terms of the delivery of the content, but and that's why in our discipline we're starting with our postgraduate diploma in public health, to see what is the best way to take it online, because we're losing a lot of students as we're using the in-person model of teaching and learning. However, and these are the discussions that we're having internally in terms of the best way of doing this. I'm partly old school in that regard, that there's still merit in doing in-person teaching and learning in the MPH. Yeah, thanks.
Thanks, yeah. I think, having done an MPH myself, I do think that there is a merit in having your colleagues around. You have very interesting discussions with people, as Jill says. Those networks or people that you meet actually take you beyond your career. Having said that, I mean, online platforms also have potential for you to engage with your colleagues, so it's not completely isolating. And so I think, again, to Nicola's point around, or was it Jill's point, sorry, around just choosing, what works for you, and then making it work. I did see a question about costs and around cost and scholarships. I'm going to ask colleagues to answer that in the chat if they can, because I do want to get to a few of the questions around, first about medicine. So just to say, a lot of the schools of public health are affiliated or linked to the Faculty of Health Sciences. But if you are asking specifically about specialization in public health, that is different departments. There was a webinar on that 2 weeks ago, which are also circulate, and that's a specialization in public health, which is separate to the Masters in Public Health, although the specialization does do a lot of the MPH modules. My colleagues, yes, Matilda, before I go on to the next question.
I think I thought I should talk on the 100% online program, because I'm offering it from our institution. I realized that we started with a mixed, sort of a blended kind of learning, where the summer school and winter school would be face-to-face. Then, since COVID, everything was done online. Then we optimized on our examination broadcasting, sort of an invigilation system, where our classrooms have, full broadcast. And I don't know, there's a sense of when you are 100% online, it tends to activate your sensual attributes, because you connect with these students using these online tools to a point where you make them react to each other and the faculty, maximally, optimally, if I may say. And then, and we really thought, if we can invigilate them and support them for 5 hours on an exam, open book exam, and make sure that there is integrity, we could easily optimize it into a broadcasting a kind of a classroom setup. And that works well. And I think it enhances just your sensual attributes of connecting with students, even when you don't know them. Like, I was shocked to see 61 students that I never saw before, passing the stage today, thinking that I know them, one way, and we kind of clicked physically when we met them. So the 100% online system has extra efforts and attributes that faculty should embrace for them to be able to succeed in producing candidates that are not deprived from interaction and engagement. Thank you.
Thanks, Matilda. All right, colleagues, I think the next question that I want to move on to is about, what you can do within MPH. And I know Nicola broadly, highlighted some of the career options, but I think I want to mention two things. One is UCT has, if I'm not mistaken, Jill, a really great module called a practicum, where students can do an actual practical immersion in a setting and do a project that can become a bit of a portfolio of work for them. And the reason why I'm highlighting this is because, from a few colleagues that I've spoken to, especially if they are not working in a setting where they can utilize their skills, they do find it difficult. So, for example, doctors who are working in clinical services and then have an MPH, they're not sure exactly how to translate those skills across or move into a specific, field or a job. And I know there's a move, colleagues in the UK are starting with sort of internships for MPH or like mentorship for MPH students to allow them to get some of that, real world experience so that it's easy for them to transition from whatever their background is. So I was just hoping maybe we could do some reflections around, or any advice for, anyone who is watching around what you can do within MPH. So the possibilities are vast, so I don't even know how you're going to answer that question, but, sort of where an MPH can take you, how we could augment your skills, and, any advice on how to merge your undergraduate background with your public health masters. So Sean, I'm going to go over to you first.
Yeah, thank you very much for that. I think perhaps just for the benefit of the group, we are a number of individuals that are actually involved in a project looking at all the MPH graduates from all the schools of public health at universities in South Africa to actually look at, one, to see to benchmark MPH programs, and secondly, to have a look at the career paths. So I think Nicola's probably the better person to answer this question, because we do have there's two students, master's students, that were looking at one during the COVID pandemic. What are the roles some of the MPH students played? And the question was really, you are now an MPH graduate with all these skills. And in the interviews we conducted, it was, we were from different universities, and you've now graduated with this degree. Has your degree placed you in a position to make a positive contribution? And if so, which are the modules you found to be beneficial? And if not, what do you think would you have liked to be included? And just to touch on two specific things. The one thing that most of the students actually say is that they wish that there were more analytical skills, so more epidemiology, more biases, because that's really what they want to use more, as well as monitoring and evaluation. That was one thing, especially with the UP students, that came out quite a lot, because in the current work that they are doing now, regardless where they are in, those are the types of skills that they do require. So I mean, this project will be ongoing, and from who I have in the room, we can each contribute, but it was looking at what is this career path really, and are the different schools of public health or different MPH programs, do they allow the student to gain all of these skills? And if not, perhaps then if one university has a group of skills that is more essential, should the other universities be adopting that? Should we be, how actually do we go about thinking about that?
Thanks, Sean. Pindile?
Okay, hi, thank you, Atiya. I will just speak from the point of view of students who enroll for a master's by research. It enables them to be able to conduct, ethical research, to start with scientific research, to gather evidence that is able to be used to influence policy and practice. Most of the time, those students that enroll for Masters by Research are already in the field. And we all want to see changes. And we can see the world where we live now is so agile. So how would you gather evidence, really, you know, for something that will work or to influence what's already out there? And if you look at those that do research studies, we have implementation science, for instance. And that is a project fortunately, we're lucky to get funding recently for a project on implementation science. And that is a much needed field as well. Because most of research that has been done, students gather data that is just, and then they graduate, and nothing more is done with that data. And it cannot even influence the context where the students are. So that is my take when it comes to understanding research within your area of interest. And I would just advise everyone who wants to enroll for a master's, ascertain your area of interest to avoid getting a qualification that at the end of the day, you will not know what to do with it. Thank you very much.
Thank you, Pindile. Jill?
So I just wanted to say that it's certainly for us, and I think also for a lot of the others, the MPH is understood as not necessarily not classified as a professional degree, but it is certainly a praxis-oriented degree. And so that does, so for example, it's not just the practicum that you mentioned, Atia. I mean, our whole MPH is structured towards workplace learning, you know, praxis-oriented learning, real world, you know, if it's research, it has to be real world research. All of those aspects are blended across all of our courses. And so I think it is very much, I mean, that's what the field of public health is. It isn't about sitting in an ivory tower thinking about deep thoughts. It's about engaging with the world and making the population a healthier population. And so really that is why I mean, all of our MPHs are oriented in that way. It's very difficult. I often have American undergrad students who email me and say, what career can I do with your MPH? And I find it an extremely difficult question to answer because we have graduates from every walk of life. We usually name the ones that are the most exciting, the ministers of health and the people leading WHOs and all of those kinds of things. But we have people who take the MPH into becoming a health journalist, or people who take the MPH into a variety of activities, people who take on M&E work as a consultant going forward. I mean, there's any huge variety of career pathways that you can take. And I think it was Nicola that mentioned many people already have careers and they use the MPH to upskill in a certain way. And so I think that's why sometimes the competency conversation is quite useful to have. I'll put some of the core ones that we have in the chat, but it's sort of like, what are the key analytical skills you should get out? What are the key experiential skills you should get out? But I think in any of our MPHs, you should be getting out real practical, real world experience and knowledge. I'm just speaking for everybody here, sorry, but I think that's the answer to that, and that you should be able to take into thousands of different career pathways. Thanks. I'll stop there.
Thanks, Joel. Nicola and Sia?
Yeah, just wanted to add, I mean, I think a lot has been well said. But firstly, I think where students do engage in a field of specialization, I think to some extent that does guide career pathing, both in terms of where a student might be coming from as well as where they're going. Some of the research that we've done on our graduates or, with our graduates is really sort of showing that students actually move often into management positions if they're not already in management positions, or more senior management positions after getting an MPH is often an entry requirement for certain types of jobs. You know, you have to have an MPH to even be considered for certain types of jobs. So that's often a motivation for students to do an MPH because they are wanting to have those kinds of opportunities, whether it be for example, sort of a coordinator of a research project, for example, often requires an MPH to, sort of being able to be promoted, sort of within departments of health and other kinds of entities. But, at the end of the day, I think it will vary a lot in terms of, as Jill said, sort of like the options are really numerous, and there isn't just a single discipline or a single path within public health, which is one of the reasons why it does make it challenging. But in terms of frontline providers, I wanted to just talk briefly about that, because I think Matilda mentioned that you do accept a lot of sort of frontline healthcare providers who are either, sort of in therapeutic sciences or in clinical medicine or and so on. One of the things that we find interesting is that often students are not able to always apply, sort of all the skills that they're learning immediately. So because often when you're at the coal face as a healthcare provider, you primarily sort of thinking about delivering services. So, you're not at the level of being able to necessarily plan, prioritize, sort of do M&E of health systems, for example. But it does sometimes allow people to get entry into a sort of management position, which would allow them to do some of those things. Yeah, thanks. I'll stop there.
Thanks, Nicola. So before I go to Matilda, we have just a few minutes left. So what I'm going to do is I'm going to give everyone a sort of 30-second last reflections. Matilda, if you can tie that into what your comment is, and then we can close.
Yes, on what Nicola said, for practitioners or professionals that don't go out of their clinical practice of specialization, basic foundation immediately, we really want public health to be an inspectorate, a warning sign, because as these people have public health disease prevention control, they would be able to visualize their statistics or their district health barometers differently and be able to perform and apply public health at the level that they are before they even get promotions. So especially because we are going to universal health coverage, we want them to be aware of what primary and prevention issues that need to take place in their workspace. Thanks.
Thanks, Matilda. So I'm going to go in the order that everyone spoke. So Jill, over to you.
Sorry. Similar, just to say thank you for this opportunity. I think all of us as institutions don't need to compete with each other, because it's such a huge field and there's such huge demand that that in a sense it's really as a prospective MPH student, I think it's about finding the right home for you, and that will depend on where you are, who you are, what you can afford, what time you can afford. I just thought, as a very small aside, I've just been watching the chat questions. If you're a prospective MPH student, I think you have to realize that you're going to be judged, your application is going to be judged as a master's level, not as an undergrad level. And so I would strongly recommend that you really do deeply analyze the websites of the institutions that you are applying for. Don't call any of us in the middle of the night asking, is there funding and those kinds of things. I promise you all the information is on the website. And I think there is some expectation that if you are saying you can do research at a master's level, it does mean that you can download a course brochure and read through it. So sorry, I'm not trying to discourage any questions, but I do think there's something about doing research on your prospective institution that you would like to apply for, and being strategic about the applications, that you're not disappointed. Thank you.
Thanks, Jill. I just want to add to that to say part of the rationale for this is to answer the basic questions, so that if you are approaching MPH departments, you ask quite targeted questions that are pertinent to you and not something that you can find on a webinar or on a website. All right, thank you, Jill. So I'm going to hand over now to Findile for last reflections from you. Pindile? I don't know if Pindile can hear us. Okay. I'm going to move on to Siyabonga and then I'll just message Pindile.
Okay, thanks, Atya. Yeah, I just wanted to say that what we find with our students, most of them get into or apply for the MPH for the purposes of upward mobility in terms of their careers. And so already, and some of them may already be in those positions and they just want to deepen their understanding and you know, and increase their level of contribution to the work that they're doing and be more effective in those positions. And particularly, we do have students coming from research institutions as well, like the MRC, HSRC, and those. And so then the importance of choosing the kind of topics that they you know, engage in terms of research. You know, they work on topics that are really important to them and they're passionate about because they're highly linked to the work that they do at that time. And you find that you know, the experience of the MPH is so much it's so much better because of those you know, they see how they can apply what they're learning to their current jobs and how it can help them to move upwards in the, you know, in their current institutions, or even go to other institutions which may need that deeper understanding of public health and things like that. And so I think, and I agree, there's so much space for all the institutions to work together and maybe even collaborate in some you know, projects going forward. I saw someone who had a similar background to mine in terms of HIV research and things like that. And so, you know, I think the sky is the limit. Thank you.
Thank you, Sia. Pindile?
Thank you, Atia, for this engagement, and for all the colleagues who are with us tonight, and those who are online as well as participants. And I would just like to say that the field of public health, we have seen now is very important. And for two participants, I would just say that one needs to first think of the reason why you are enrolling in the MPH in the first place. You know, and work with that. Why are you enrolling? And that also helps you to make a choice on where you are enrolling. If it's for career progression, at least you can have an idea as to where you will move to from there. And if there are various streams offered, you can choose a stream from that knowledge or, you know, from that direction that you have in mind. If it's about exploring, then you will know that you are enrolling to explore and you will just take it from there. Otherwise, it is a very interesting field. Very interesting, yeah. Thank you very much, and have a good night, all of you. Thank you.
Thank you, Pindile. I'm going to go to Sean and then last again, but not least, Nicola.
Yeah, thank you. Thank you very much for the invitation and for allowing us to share the programs that we have. And I want to echo what the other panelists have said. You know, there's so much expertise and so much variation in the programs offered at all the universities. And I think for any person applying, it's really to think about, and I mean, I have to agree, if you are based in Johannesburg, but you want to do a degree at university, there will be traveling involved. So there's a whole lot of things to take into that you need to take into account. And I think when you are choosing that where you want to be, go and have a look at our websites. We all have taken quite a lot of time to add in the details, to add in the information, our research fields, the courses. So do all of that preparation work. So when you do apply, you know that when I'm going to that institution, it's expected for me to be there in person. So there are some other commitments. And if I can't do that, we have institutions that do have their programs are fully online. Perhaps that is a better choice for you. And like the colleagues have said, that very often we all work together on research projects. If I know there's someone at the institution and this is something we can do, we do, we go supervise, we do all of that. So it's really for you as the applicant to see where do I belong, and what are the different courses and modules that are there. Where is it that I really want to be? And all universities tend to have different sets of expertise, and that's what a student should really be looking for.
Thank you, Sean. Nicola?
I just want to say that, just end by saying that I think that taking on postgraduate studies, a master's degree, while you're working, while you have a family, is challenging. And it does require some commitment, and it does require some balancing of these different priorities in your life. So if anybody is keen to pursue an MPH or a postgraduate diploma in public health, I think you need to think about it very deeply in terms, and have discussions with loved ones in your life and with your employer, so that you can actually get them to support you and be behind you. Because at the end of the day, so many students end up, sort of really struggling with things along the way that actually make it so much harder. And so it's just a plug for a little bit of, kind of like balance and commitment, sort of at the end of the day. But thank you, Atia, for organizing it, and for everyone's great input. I really enjoyed listening to all the input. Thanks.
Thank you. So thank you, I think, to all of our panelists today. As you can all see, they are all highly busy people who have taken generously of their time after hours to hold this webinar and indulge me with my crazy ideas. But I do hope that this has provided some information to anyone interested in pursuing public health. Again, a master's in public health is one pathway into public health. There are many, many other institutions that offer MPHs. Unfortunately, we couldn't have them all with us today for various reasons. There's many streams within public health as well that are outside of a Masters of Public Health. And so, we do encourage you to do a bit more reading and research. Having said that, I will circulate to all those that registered the recording of this webinar, links to recordings of previous webinars, links to the career conversations that we've been having, and some of the information on the chat with specific, contact details for the departments themselves. So with having said that, thank you to all those who provided information, to all our panelists, and to everyone who is engaged. And I wish you all well, and we hope that we will see you in the public health spaces one day soon. Have a lovely evening, everyone.
Thanks, Atia. Thanks for organizing.
Thank you.
Thank you much,
Have a
everyone.
good night.
Bye.
Thanks, everybody.
Bye.